Hi, my name is Tim Yerrick. I'm the principal here at Sheppard Pratt School, Hunt Valley. Opened in February 2008, our school grew out of the former schools that were previously located on the campus of Sheppard Pratt in Towson. Sheppard Pratt School, Hunt Valley is a 12-month non-graded program for students with autism and related developmental disabilities. Students are referred to our school through the IEP process because our current school system cannot meet their academic, functional, and behavioral needs. All of our students are on a certificate track and are therefore eligible to be in school until the school year in which they turn 21. Our school's mission is to help our students become lifelong learners and responsible citizens. We do this by providing individualized instruction that focus on teaching students functional life skills, which include skills such as independent living, social, academic, communication, and self-regulation skills. We can serve up to 72 students and maintain a 2-to-1 staff-to-student ratio, with many of our students having 1-to-1 staffing based on the IEP. Classroom placement is determined by factors such as age, size, social skills, communication skills, behavior challenges, and academic ability. We would like to show you some of the features of our school that make it such a great place for our students to learn.
Hi, I'm Lindsay Leinhauser, the Senior Speech Language Pathologist. The Speech and Language team consists of 5 therapists. The SLPs have very manageable caseloads that allow our therapists to spend more time with our students outside of their IEP hours. The SLPs are able to spend more time training staff, observing in the classroom, and co-teaching. The clinicians use evidence-based interventions to plan for their treatment sessions and determine appropriate models of service delivery for each student's individual needs. Pull-out services can occur in the clinician's office to ensure one-on-one interactions to establish skills. However, we also recognize the importance of generalizing functional communication skills. So the SLPs also push into academic and vocational work, as well as attend community outings such as going to Burger King or the grocery store. The SLPs provide parent contact and training to ensure that we're also helping generalize these skills into your home. The speech team creates and implements a word of the month school-wide. This allows visuals to be put up around the entire school so that all of the students have a common focus during that month. The SLPs create visuals for all aspects of the school to help aid in comprehension and expression for our students. The Related Services Department puts up various shops during holidays to allow students to practice their skills in a realistic setting. They can greet customers and work the shop, or they can come up to the shop as a customer. We also know the importance of peer modeling and socialization. The SLPs create groups of students that would benefit from working together in various social skills groups or device groups. If you have a child with complex communication needs who requires the use of a speech-generating device, we have access to an entire device library within our school that allows us to trial various language systems and determine an appropriate device for your child. We also provide funding support for devices prior to a child's graduation to ensure that they have their own speech-generating device when they graduate.
Hi, I'm Laura Nihas, Assistant Principal and former Curriculum Specialist. I supervise our team of special educators and educational assistants. I work closely with the curriculum team to support classroom instruction. Our curriculum team is comprised of 3 curriculum specialists, a vocational program assistant, and a transition coordinator. Our school uses curricula that focus on teaching functional life skills to help our students become more independent at home, at school, and in the community. Our average class size is 6 students, and our student-to-teacher ratio is 2-to-1. This allows us to individualize instruction and home in on each student's specific needs. Each classroom has an interactive smartboard that helps engage and motivate students during group instruction. Students also have access to iPads for both instructional purposes and reinforcement. Each classroom has a structured daily schedule. Students use individualized written or picture schedules to help them navigate their day. Mini schedules are also used to break down intervals into activities, providing students with clear expectations and fostering independence. Students in Middle Hall are introduced to vocational programming, where they are able to begin practicing a variety of job skills and important work behaviors. When students transition to Upper Hall, they are able to participate in a vocational program that involves classroom instruction, school-based instruction, and community-based instruction.
Hi, I'm Patty Kunder, Assistant Principal and former Curriculum Specialist. I supervise the behavior and curriculum support teams. Our behavior program follows the principles of applied behavior analysis, otherwise known as ABA. Our focus is teaching students socially significant behaviors to replace maladaptive behaviors. Behavior programming for each student is developed using data-based practices and decisions. In developing behavioral interventions, the behavior team collaborates with other school departments. All school staff are trained on behavior principles, positive behavior supports, behavior modification, and management strategies. With a new student, staff capitalize on opportunities to build positive and meaningful relationships that serve as the foundation to the student's learning experience. Each student has an individualized reinforcement system designed to establish clear behavioral expectations and reward appropriate behaviors. Examples include token boards, first then boards, self-monitoring checklists, and work break schedules. The students are taught replacement behaviors using the aid of visual supports. A student may be taught to ask for a break by presenting a break card in order to appropriately escape work.
Hi, my name is Dr. Azia Adegechi. I am the Related Service Manager for our school. I ensure we are in compliance in terms of providing occupational therapy, speech therapy, and physical therapy services in accordance to your child's IEP. We have 3 full-time occupational therapists in our school, which means every therapist is assigned to 4 classrooms. The role of occupational therapists in our school team is to identify and treat motor delays and sensory differences that often occur with autism spectrum disorders. We may work with your child in one of our treatment spaces, do a theme-based group in your child's classroom, or push in during your child's routines, either in their classroom or community. If your child has difficulty with tolerating sensory aspects of some routine activities, we initially work in our treatment room, trialing different calming strategies, as well as treating the underlying sensory issues. We may also make modifications to environment or to tasks until there is a positive change in your child's nervous system. We may also trial and use some adaptive equipment in order to address the motor challenges that some of our students experience, so they can be more independent with activities that we do on a daily basis, such as self-care, functional life tasks, or work. For older students, we make sure our students have strength, coordination, and motor skills related to their job assignments. We frequently collaborate with the team in identifying jobs that are a good match in terms of one's motor skills, as well as the sensory environment and components related to performing job assignments while they're enrolled in our school, as well as post-graduation. This is our sensory integration therapy gym. The equipment in this room are designed to stimulate different sensory systems in order to help our students regulate their attention and arousal level. In addition to our treatment space, your child occupational therapist will design either a formal or an informal sensory diet for them. These are activities that are safe and are scheduled throughout the day. Some examples of these activities include riding a bike, wagon rides, going for a walk, carrying weighted items, and various fidgets. This is the OT apartment. We use this room to work on motor components of various functional life tasks, such as folding laundry, cooking, putting grocery away, and washing dishes. The students refer to this room as the bubble room. This is a room that's prescribed by your child's occupational therapist. The room is designed to help our students feel calm.
Hello, I'm Christina Mayhew, the IEP coordinator at Sheppard Pratt School, Hunt Valley. When your child's referral packet is received at our school, I am your first point of contact. I will help guide you through the referral and orientation process. I'm also available to answer any questions about your child's IEP-related services and behavioral needs.
Thank you for taking the time to learn about our school. We look forward to getting to know you and sharing more about our program.